Hey everybody, we are going to talk about physician's assistants today. So we're going to talk about physician's assistants today just so that y'all have some perspective on another type of healthcare career. And then we're going to talk about the rest of this week. We're going to talk about some really important stuff. Most of you guys are juniors or seniors, and what is important to you guys now is many of you should, hopefully you already have, especially if you're a senior, filled out your FAFSA. If not, you really need to know what FAFSA is and what will be coming with for you guys next year that you'll need to be filling out. We're going to look at SAT, ACT. We're going to look at getting into colleges, how to apply to colleges, the common application. We're going to look at all those things the rest of this week as well. And you're going to do some college research at the beginning of next week. So let's talk about the power of the physician's assistant as a profession. Duke University was one of the first universities to have this program. Today, there are hundreds of thousands of physician's assistants, and they practice. And what a physician assistant does is a physician assistant practices under a licensed physician. So they don't have to practice in the same office, but they have a physician that comes in and reviews about 10% of their charts to make sure that everything is accurate. Also, they come in about every 2 weeks to do that. Also, that physician has to be available for the PA to consult with. So if I went in and I had something that the physician's assistant wasn't really sure what was going on or how they should manage my care, they would consult with their signing physician to get that set up for them. So, but we physician's assistants are widely in practice throughout the U.S. What is a PA? They're a nationally certified and state licensed practicing healthcare physician. They have a graduate level education. They have to go on past a bachelor's degree to get. It's about a master's program, and they can practice in the medical, like in a regular family practice physician clinic, in any medical practice, or they also can practice in a surgical setting if they have done their specialty training. There's a PA or physician's assistant who has a PhD in Silver Springs. His name is Mike Short. He works hand in hand with Dr. Graves in Silver Springs, and he does surgeries with him, all those kind of things. He's a wonderful, very, very well educated, very good physician's assistant who also is in surgery with the physician. So he's just one I know right off the top of my head I can talk to you about. So what do PAs do? They practice medicine. They practice, like a nurse practitioner, they practice medicine under the guidance of a physician. What can they do? They can perform medical procedures. They can order and interpret tests. So they can order labs or CTs or MRIs or all those kind of things, and they can interpret those. They can write prescriptions. In the state of Texas, they cannot write Schedule II drugs. Some states allow it, but in the state of Texas, they cannot write Schedule II drugs. Which would be things like hydrocodone, fentanyl patches, things that are they can't write stuff for ADHD, and they have to have the physician write those prescriptions. They can assist in surgery. They can counsel on preventative health care and health and wellness. So that's kind of what they do. They diagnose, they treat, they do many of the same things as a physician does. They do have a smaller scope than a physician. In 2016, 101, so they have made changes. In 38 states made 82, so they made legislative improvements to the care that can be provided. And they made regulatory improvements. So they made laws as well as regulations related to how PAs can provide. And it was a positive change. It gave them a little more availability to do things. PAs are changing the way we view healthcare. They're also changing the healthcare model. PAs and nurse practitioners, the new healthcare model shows a physician, a nurse practitioner, a PA, or two PAs or two nurse practitioners, and a medical assistant, and a couple of medical assistants all working in one facility to enhance the care provided by by physicians. So they have an increased access. Having PAs available increases access to healthcare, especially in rural areas. It lowers the cost of healthcare because PAs generally charge less than a physician to be seen, and it increases the quality of comprehensive care. So since it's team based, you're going to see that PA, but if they're worried about anything, they can talk to their managing physician, and then they can get those referrals out and done. So that also increases the quality of care. The number of PAs is trending up, like the number of nurse practitioners. We're having an increased number of PAs and nurse practitioners. We are having fewer and fewer family practice physicians. The demand is increasing rapidly. 400 million patients are seen by PAs a year. That means a 300% increase on the demand from 2011 and 2014. The rate of employment for PAs went up 30%, and the 76% of PAs who are graduating have multiple job offers. So know that it is a broadly, rapidly expanding program. Nurse practitioners and PAs are part of healthcare that if you want to be a provider but maybe don't necessarily feel like you have the capability to go to college and through residency for 12 years, this may be an alternative. And it is in high demand, and it is going to continue to be a high demand career. So it's one of the most promising jobs according to Forbes and Glassdoor and Young Invincibles. The becoming a PA in between 2015 and 2018, the percentage of growth is about 180%, but our enrollment for PAs is actually has been steady. So the demand is higher, but we're not having an increase in the number of people who are going through those programs. It's one of the number 5 best jobs in the U.S. to be a physician's assistant. And it's number 7 on high-paying jobs with Glassdoors. So when we think about what a PA makes, a PA graduating from a program, from their master's program, and finished all of their clinicals and everything, their salary is going to range in our local area. And I can say this, I have been teaching for 3 years. So prior to 3 years ago, physicians assistants or PAs were hired at, depending on their specialty, anywhere from $90,000 all the way up to $130,000 just in this area. So just know that even in a rural area, the pay is good. On top of the difference in a PA and a doctor is a lot of PAs don't have to do call. A lot of PAs don't do hospital rounds in our area. A PA basically works their regular clinic hours. I don't want to say 8 to 5 because it's really not 8 to 5, because PAs come in early and they stay late to chart, but it is a fairly stable hour position. What could you expect if you wanted to go to school to be a PA? PAs can practice with autonomy and see their own patients. They don't have to refer to the physician for every patient. Medicine in general is moving more towards consolidating care, where we receive that team-based, value-based care. That's what insurance companies and Medicare, Centers for Medicare and Medicaid are wanting. They're wanting that team-based care a lot of smaller doctors' facilities are being bought, doctors' offices or groups are being bought out by larger hospitals, and they're wanting that ability to have a physician who's over up to 5 PAs and nurse practitioner combos, so that they're also getting more bang for their buck as far as the people who own that facility. And then they're being able to charge appropriately and provide more affordable care for patients. In 2016, the average salary report, some pay came in salaries and some in hourly wages. Most often it's salaries. Many employers give bonuses they have their flat annual salary, and then if they meet their quota for patients or meet their quota for safety or they meet their quota for patient experience, then they get a bonus. Benefit, they usually get paid time off. They get a time off for professional development. They get insurance. They get retirement. They get all the same things that other hospital employees or clinic or employees get, where a doctor may not do that because they're on a contracted basis. They're providing their own retirement. They're providing their own insurance. Where most of the time, PAs and nurse practitioners are actually employees of the facility. They get the same benefits as someone in a more of a middle management position. So it's a good field to go in. I can tell you that the PAs that I worked with got about 250 to 275 hours a year of time off. It included professional development, sick time, and vacation time. That's a lot of hours. That's about 7 weeks a year. So 7 weeks a year to get your professional development in. A lot of those professional developments were actually paid for by the facility as well, because you still have to do continuing education. So just, kind of be aware of that as well. The median base salary, so as you can see, primary care around 90,000. This was in 2017. It's a little higher now. It's around 95. Internal medicine subspecialties, which means if you worked under an internal medicine physician and maybe you saw patients with multiple disorders, which is usually what internal medicine sees, they must have more than 2 diagnoses and be over the age of 18. Around 96. As you can see, emergency room PAs and surgical PAs tend to make a little more money. Pediatric subspecialties, so a physician's assistant who saw only PD patients, a little more money. So you can see there's a median base, or there's a kind of a middle of the road base for all PAs, which I said is that usually 100 to 130 depending on where you're working. New PA base salaries by specialty. So that's the median salary. I'm going to say those are a little bit low for our area, because in a rural area, we tend to kind of pay a little more because we need that care. We need to be able to provide services to our patients. PAs who are working in a hospital, this is the percentages of them. Most of them work in a physician's office, so about 49%, 37% work in a hospital, about 5.7% work in an urgent care. We hired 2 brand new PAs where I worked before to work in urgent care. 1.2% work in colleges, and about 6% work in all other specialties. And so you can see the percentage of PAs that are in surgical. About 26% do surgical, 24% do primary care, 10% do emergency medicine and internal medicine, about 1.5% do pediatrics, and then about 26% do other specialties like urology, nephrology. They work in those clinics with those physicians, surgery office, those kind of things. So for more than 50 years, physician's assistants have been helping make a better environment for our patients. So I just wanted to give you guys some information on PAs. I want you to take a look. Take a few minutes to go in and look and see how many PAs are working in our area. Maybe you see a physician's assistant. I know in Silver Springs Clinic, when I was there, we had 1, 2, 3, 4, 5 that worked in Silver Springs when I managed those clinics, and we had 5 PAs that worked in those clinics. 2 in urgent care, 2 in primary, and 1 in a specialty clinic. So I mean, the job opportunities are out there, definitely. And it's something you can think about. I want you guys to also today look up schools that provide PA services in this area. I think Fort Worth may be the closest school that has PA school available. But look that up and just see and see if it's something you may be interested in. All right, everybody, have a great day. Take some good notes because I might give you a quiz over this. Thank you.